So how to prevent this coronavirus and how to prevent a coronary. My hearts go out to all those people that have been affected by the coronavirus and or a coronary event. And so this is, especially with heart disease, it's a preventable disease, meaning that you do not have to go down this path. And coronavirus, yes, it spreads very quickly, and so make sure you're safe out there. I know I'm reporting to you here from Calgary from our clinic, and I'm looking outside here, and it looks like a ghost town. And so, make sure you're safe out there. Make sure you do your best to keep proper hygiene and be safe. That's all I can ask for, and limit contact with many people. So this blog post, I'm going to talk to you about 5 things that you must do to prevent a coronavirus and a coronary. And so they do overlap a little bit. And so especially this time, especially you might be at home by yourself or isolated. And so what I want you to focus on is really improving or increasing your vegetables and fruits. And so we know that arteries are a muscle, right? You can see that picture up in the corner of our office there, but arteries are a muscle, not a pipe. And so how we treat that artery is very important. Vegetables help improve that arterial wall and minimizes the risk of heart attacks and strokes because of the antioxidants. On the other side of it, to prevent a virus or a coronavirus, it's very important to improve your immune function. And so a lot of the posts that I'm going to talk, or a lot of the steps I'm going to talk about today are to improve your immune function. And vegetables and fruits will definitely improve your immune function. So number 2, stay away from carbohydrates and sugar. I know it's a time where and please don't hoard all that, the pastas and the rices and all that. At the end of the day, you're going to end up with being diabetic or having artery disease. And so be careful of that. And so you don't want to have just that. And so I don't think we're in a deficit society right now. There's an abundance of food out there. It's just that, the grocery stores aren't used to having their shelves emptied so quickly. And so stick to the vegetables, stick to the fruits. I know they're still being produced. A lot of things that don't have to advertise to you is where I really want you to focus on. So when you have an abundance of carbohydrates, it hurts the arterial wall and decreases also our immune function, which then limits our ability to combat viruses and bacteria out there. So number 3 is get enough sleep. Sleep if you're not getting enough sleep, it can increase inflammation. It can damage your arterial walls, but it also can affect our immune function. So try and keep a steady routine. Try and go to bed at the same time. Try and wake up at the same times. And you might be off work at this point in time, but especially with kids off school, try and keep that routine. And I think that's very important. So, and also don't compromise your sleep. Number 4, don't watch the news. Okay, I'm not saying it's not important to be informed. It's very important to be informed, but to watch the news every hour of every day, that's just going to increase anxiety, increase depression. It's a lot of negative things out there. And so you want to try and focus on the positive. Be grateful for what you have. And so my suggestion is not to watch the news because it affects our mental health. And we know that anxiety and depression can lead to coronary artery disease. It can also lead to decreasing your immune function. To at this point in time, especially where we are with this coronavirus, COVID-19, it's important to keep our risk really low. Number 5, you might be at home and you might be cut up in Canada, North America. The weather is just starting to come in a little bit better. I mean, we're first day of spring today. Get active. Improve your exercise. It's time to improve your strength. Get out and go for walks. You're allowed to walk outside, at least in North America you are. Walk outside, get some fresh air. Be by yourself so you can get that exercise, but get some steps in. Get doing some push-ups or pull-ups or something that you can do at home. There's a lot of now online workouts that people are doing. So just get active, get moving. Why? It improves the artery function, improves the skin of the arterial wall, and also, number 2, it improves your immune function. So it's very important to improve your immune function so that we can see that improvement to heart health and minimize our risk of coronavirus, minimize our risk of COVID-19. And lastly, I'm going to leave you with a bonus step. Get tested. Get your heart tested. Come to a heart fit clinic. Understand important test to prevent a coronary or heart attack or stroke. Remember, the majority of heart attacks and strokes occur with blockages that are less than 50%. So get tested, and same with viruses or any vaccinations. Get vaccinated or get tested for the COVID-19. If you're worried about this, I'm not sure we're there yet where we can get this test readily available, but it's very important to be on top of these things. Make sure you come to the website, some great free information at heartfit.ca. Be safe out there, minimize contacts with other people, like keep your groups to a minimum, proper hygiene, and of course take care of your heart. That's very important because you only have one of those. Look forward to helping you live happier, healthier, longer, and be safe out there. Diamond Fernandes.